Assalamu alaikum wa rahmatullah. Masal khair and good morning, good evening. We are glad to have you today with us in this special webinar. Actually, with all the challenges and emergencies that our region faces nowadays, we at MFNet, we started a series of webinars to discuss the ongoing conflicts, the humanitarian status and health consequences in our region. We highlighted the emergencies in Sudan and Gaza. And in our previous two episodes of the webinar, we have discussed with experts and health professionals from our region and beyond the issues like human rights, how to enforce the international humanitarian law, the needs of our people in those specific areas. I'm referring to Gaza and Sudan. And this third episode, actually, it coincides with the memory of having 1 year of the war in Sudan. And it is my pleasure to host three of the esteemed public health leaders and professionals in our region here. By having this webinar, actually, we are aiming to provide an overview of the humanitarian situation in Sudan, challenges and interventions, also conducted by the Ministry of Health and partners. Also, we will try to forecast the potential short-term and long-term consequences and impacts of this conflict on the health of the people's health as well as on the health system. And third, we are going to explore various strategies to enhance the international support and advocate for the case in Sudan. So I'm not going to take long of your time, and I will leave the floor for our speakers today. So if you allow me, I would like to start by introducing our first speaker, His Excellency Dr. Haytham Mohammed Ibrahim Awdullah. Dr. Haytham is the Federal Minister of Health in Sudan. He brings a wealth of experience in the healthcare system, management, leadership, research, and academia. Overall, he has the vision and wisdom that enabled him to lead the health in Sudan during those challenging times. Dr. Haytham assumed senior position at the Ministry of Health, higher education institutes and universities, plus other international private and NGOs. If you allow me, Your Excellency, I would like to start this webinar by asking you about now after 1 year of the war in Sudan. Could you please share with us what is going on? How is it there in Sudan? I would like to know more about the health status, the challenges on the ground, and we will continue our discussion as we go on with this webinar. So the floor is yours, Dr. Haytham. You have 15 minutes. Thank you.
شكرا جزيلا. Thank you very much, Dr. Haytham, and thank you very much for Infinite family and for this platform, gathering together a number of experts from all over the world. And I'm very glad to be among the panelists, distinguished public health experts, Prof. Salman, Dr. Shibli, and Dr. Muhannad. Let me to start by hoping peaceful in short time, peaceful life for the people of Sudan and for the people of Gaza and for the people all over the world. I would like to start by providing some of background information about the health system in the country and what's happening over the last year and the way forward from our perspective. If you could share the presentation, please, from your side, Haytham. Actually, it is a nightmare challenging year last year since April 15. And if I look back to the health system in Sudan, there was a series of health system reforms since 1990s. And there was a progress over the last 20 years. For example, the National Health Insurance Scheme covering almost 80% of the population, National Specialized Services Program for kidney transplant, liver transplant, advanced cardiac surgeries. Also, in the primary health care and health for all by all, universal health coverage program and primary health expansion project since 2012. But unfortunately, since 2019, next slide, please. The Sudan health system was facing a number of challenges and became very fragile due to a number of externalities to the health system in the country of Sudan. Like, for example, instability, political instability since 2019 and the revolution. And the politician in the country did not come to one system governing and leading the life of the people in Sudan. Also, this accompanied by a number of social and economic crises over the last 2 years. During the same time, we face, like the rest of the world, COVID-19 emergency and the lockdown of the country, and what the heavy impact on the health system all over the world, and the heavy impact of the weak health system like health system in Sudan. This also have been deepened by the number of epidemics and outbreaks Sudan is facing every year during the rainy season. Every year, Sudan is facing hemorrhagic fevers, number of high burden of malaria, sometimes heat stroke, sometimes meningitis, and others. And also the political instability and the deal and the relationship with the external world and with the donors resulted in freezing in number of global support projects dedicated to Sudan. And this since 25th of October 2021. Also, this resulted in impacting the health system in Sudan. This is in brief the health system prior to the emergence of the war in April 2023. Next slide, please. Of course, war has a serious effect in all countries. And in Sudan, this war is a little bit different because it started from the capital, the center of Sudan. Also, the war is affecting almost 50% of the country land, expanding gradually to states from Khartoum at the beginning, then affecting Darfur, then Kordofan, then Jazeera. And this serious creeping of the war with intensive army conflicts started in central part of Sudan, where we have almost most of the specialized services and the ministries and the government is centralized in the country, despite the country that is very large country with 18 states, more than 180 localities distributing in almost a very wide area. But actually most of the advanced or specialized services and most of the government ministries located in Khartoum. For that reason, the war started in Khartoum, lead to paralysis of all systems at the beginning, as I will say later. But let me to say some of the direct effect on the war, like, for example, destruction in the health institutions, whether hospitals, academia, training institutes, laboratories, all has been destroyed or looted, either partially or completed. Also, the destruction and looting of the cold chains, of the supply chains of medicines from the National Medical Supply Fund, which almost estimated to $500 million US. We have started to distribute to other states before the rainy season last year, but unfortunately, the emergence of the war on 15th of April lead to lose all that store. Also, more than 50% of the ambulances, of the vehicles, of the trucks of the Minister of Health has been looted in addition to specialized diagnostic center, therapeutic centers, and the direct effect on the environment. And unfortunately, and what is more sad for us, losing of health personnel attacked during their professional work in hospitals, or providing life-saving interventions for people, or providing vaccination in rural areas in Darfur. We lost more than 40 of the health. Also, of course, after 1 year, the impact of war after this lengthy and protracted crisis, I think the long-term impact will be more serious for the country and for the health in particular. Like, for example, this war, of course, after 1 year, will lead to some changes in the ecosystem and environmental system of the country due to destruction of the environment, of the soil, of the water, of the services in the country. And more fragility will be the health system in the future. If I look at the country of Sudan, there's a variation between states. Some of the states a little bit stable and providing the services, but they are facing exhaustion and overload of the services due to the high influx of the IDPs. On the other hand, some states facing destruction in the health system, hard-to-reach area, and under coverage of the services in some of the area, like vaccination, for example, and nutrition. On long term, of course, this will lead to childhood diseases and illnesses and vaccine preventable diseases, of course, and it may lead to increase, exaggerate the depths of malnutrition in the children. And you all know that already the childhood indicators in the country and mother indicators and health indicators in general in Sudan and are very far to achieve achieve the development goals by 2030. Also, the accumulated complications of the chronic diseases. Sudan is facing the double burden of communicable and non-communicable disease. Also, non-communicable diseases are on rise. The renal failure, the diabetic patients, and those patients, almost more than 6 million people with diabetes, for example. Accumulation of complication may lead to high mortality, high morbidity, and also what of the expected impact, the brain drain and outflux and out migration of the experts, of the trained personnel outside the country. Yes, of course, if this war for short term, most of them, they are trying to come back and looking ahead for security, for peace, for in the country, to come back and to practice inside the country. But as the elongation of the war and extension of the war, some of them, of course, may commit themselves to work outside the country, and it will be difficult for them to come back to Sudan. And actually, this is one of the biggest lose of the health system in the future. Next slide, please. Despite that, we in Ministry of Health with other partners and the cabinet in the Ministry of Health, we have started very early, since the 4th day after the war. We have conducted the first meeting with all state ministers and the senior cabinet in the Ministry of Health, and we have identified 5 priorities as a response plan. And these 5 priorities communicated with all actors and partners, and has been breakdown into a number of projects and activities to enable ourselves to respond to emergencies, whether clinical emergencies in the hospitals and rising number of injured people, and also to respond to emergencies in epidemics and ensuring continuity of the services. The 5 priorities identified were, until now, we are working on the same response plan, on the same, after 1 year, and after revision, we opt to continue with the same 5 priorities, which are ensuring essential supply of life medicines and critical consumables for the country. Second, to ensure the continuity of emergency basic health services in hospitals and health institutions. And the third one is to enable the health system to control epidemics and outbreaks like cholera, like dengue, like malaria in the country, and reducing the mortality and morbidity of these epidemics and outbreak. And the fourth one is to ensure the continuity of maternal and child health programs and services in different states, like vaccination, like maternal programs and nutrition. And the overarching priority for us is to command coordinated response with all actors, with all partners, with all UN agencies, international NGOs and all actors in health, those interested to provide and to support health. We need this coordinated intervention to ensure one response plan, to ensure best use of the available resources in the country, and also to promote together and advocate for more support for the people of Sudan. With these 5 priorities, actually we address all the country, all the region in Sudan, whether that area covered by or controlled by SAF or controlled by militia, RSF, regardless, because we are dealing with the people of Sudan, we are dealing with the children of Sudan, we are dealing with the mothers of Sudan. For that reason, we are trying our best to find routes, to find models or modalities to ensure achieving these 5 interventions and activities in all areas, whether in Khartoum, in Kordofan, in Darfur, Red Sea, or White Sea, or White Nile. Next slide, please. Of course, over the last 1 year, it is not constant. It is not one picture from the beginning of the war till the end of the year. Not one picture over the time, and also not one picture regarding the area in Sudan. As I said earlier, there is big differences in Sudan between the area controlled by SAF now, whether we have large number of IDPs, they feel safe, they feel secure. The health system in the area controlled by SAF actually receiving this high IDP, almost 70 or 80% of the population of Sudan now are IDPs in the 9 states that controlled by SAF. And this group of states actually facing exhaustion of the health system, overburden of the health system, high number of the people need services, clinical and other services. On the other hand, of the country area controlled by militia RSF, people flee out of these states. These states are hard to reach for us, hard to provide interventions. Over the time, as we have seen, early 2 to 3 months later, and current status, looking across the 5 priorities. In brief, I can say that in early period, we are in a paralysis stage. Not only the health system, all system. It is one of the system early awake early and start to work early in first days, but the whole country start to be paralyzed because this war come of a sudden without one expecting this thing to happen like that. And if we have seen across the 5 priorities that the first period or the early days, like a shock, like a denial for most of the people of the health in the health system, like a nightmare. We start to lose all our country's stock and almost zero availability of essential items. If I look at the epidemic, for example, it is in April. It was in April it started the war, and we are expecting number of epidemic, but the picture start to change after the war. But also, what I would like to say that there is early awakening, early recovery of the system platform of EOC. We have started the first EOC in the first week and try to gathering information from all states. If I look at the 5th component and how UN agencies and international organizations at first days, it's like everyone is thinking about how to go abroad. It is about staff security. It is about staff safety. Yes, some of the UN agencies start very rapidly to settle themselves in Port Sudan and to look to their staff and how to move ahead. 2 to 3 months later, we start to feel our feet on the ground. We start to work. We in life-saving medicine supply, we start to redistribute what available in the country from the National Medical Supply Fund warehouses in all states. And we start to identify the country need to communicate with all partners and donors. And actually, we start to receive, but limited support from donors and from partners. Over the time, we start to strengthen the state capacity and the national support team deployed from Khartoum to other states. They start to operate with the state health facilities. And after 2 to 3 months, we start to monitor the epidemic curves of cholera, of dengue fever, of malaria, of measles, and all start to rise and also start to creep almost in 12 states. 70 to 80% of the country start to face number of epidemics and outbreaks. And we start to deal with that over time. And also with UN agencies, we start to discuss how to work together. But at the beginning, there is a confusion among the international staff in that time with whom to coordinate. There are two parties. They say that there RSF, there is SAF, with whom to coordinate at the beginning. And there is a challenging also of restarting and coming back to the country, the issue of the visa, the issue for the staff to come back. At the end of the year, we start to rebalance. I think 4 to 6 months until now, we start to rebalance the situation a little bit. For example, the life-saving supplies, commodities in the country now, the availability in some medicines, like for life-saving, for example, fluids, for example, reaching 70%. Yes, there is a shortage in others, but at least we have identified the priorities and move ahead with improving also supply chain, with having regional hubs replacing the national hub in Khartoum. And also now currently some of the healthcare facilities start to operate again with the support of federal level, with support of Ministry of Finance, with support of international organizations coming back like MSF and others, and WHO and UN agencies. Now in the country, according to the last report, in Sudan, we have, for example, we have 540 hospitals. 75% of these hospitals now start to operate, either partially functioning or completely functioning, providing all the services depending on the area where that hospital is. And also the epidemic curves start to go down. Cholera, malaria, and also dengue fever. Due to the collaborative interventions at the state and federal level with all actors, introduction of vaccine, for example, and others. But what I would like to say that there is a huge risk still remaining. We are facing rainy season soon, and the vector density is high. The wash situation is not that conducive, and we may face another wave of epidemics next year if there is no preparedness on the ground. Similar in the vaccination and coverage of all states. And last month, for the first time, children in South Darfur, in East Darfur, received the first dose after 1 year of no vaccination in that area. And this is one of the successes over the last year. And that reflects what I have said at the beginning, that we are trying our best to reach the services, reach the people where they are in the country of Sudan. And now also we have a coordinated, well-coordinated cluster forum led by Minister of Health and WHO, and also with the other UN agencies now. The coordinated work on the ground is well. And also there was much contribution from UN agencies, especially WHO and UNICEF and UNFPA over the last time, number of interventions and projects, emergency care projects, and also contribution in addressing childhood interventions and also emergency program. Next slide, please. Next, I think this is the last slide. The last slide. Thank you very much. And the question is there, as raised by Dr. Haitham: can Sudan afford another year of conflict? Yes, it was a very nightmare, very difficult year. But what we have seen that despite the difficulties, that there is a room to absorb the situation. If I look at the top challenges now facing the country, there are three: inaccessibility and hard to reach areas like Darfur, like Kordofan, and this is secondary to insecurity and ongoing army clash in that area. The second is underfunding of the program, underfunding of the health system in the country. The annual budget for the health system is like in Sudan, according to 2023, is 1.4 billion US dollar. That means 100 million US dollar per month. Now we are receiving less than 10% of this amount, whether from the government, receiving like 15 to 20% from the government, and less than 10% from the global commitment. This is a huge gap we are facing now, and we need to advocate for more funding for the program in the country if we would like to continue serving the people of Sudan. And the third one also, which is unique about this war, that this war is destructing the capabilities of the health system in the country, destroy the capabilities of the health system in the country. We need to rebuild the health system in the country to save the people of the country. And to the other point I would like to raise, what deepens the problem? And I think from my perspective that the extension of the war in two dimensions has this deep impact. First is the protracted nature of the emergency. That means now 1 year almost, and continue to next year. And this continuity, this protracted emergency, I think will lead to long-term impact, as I have said, on the health workforce going outside the country, for example, on the ecosystem of the country, for example, on the health of the chronic diseases of the people, for example. And the second one, that the extension of the war for almost 50% of the country land. That means nearly 400 million kilometers in the country. 9 states now are affecting. This is a huge impact on the country. But on the other hand, what I have said in my presentation, there is some sort of resilience in the first year. This resilience, not only health system resilience, but also government resilience. The Minister of Finance resilience, contributing to the health system. The other, for example, agriculture schemes starting to start, and other ministries. And also the ability to stand on the feet despite that depth of the damage I have said. This is also one of the point to need. And the third one, it is the solidarity of the Sudanese community. Despite that 10 million population now are IDPs, but most of these IDPs, 80% from these people are hosted within their extended families, with the community. The contribution of Sudanese in this area is well observed to whole people in the world. That is, it is distinguished and unique, and we need to build on that, to build on the strength of the community of the Sudanese, the solidarity of the Sudanese people. And also then another opportunity for Sudan. Sudan has many of countries that are in good relation with and contributing, like, for example, Gulf countries, regional countries, regional partners that can support the country and can support rebuilding of the health system. And the last one, which, what I would like to say, and the important one, what I would like to say, that our white coats, our white army, the health workforce capacity in the country. Sudan, one of the strengths of the health system in the country, that is the production, high number of the production of the specialists from National Medical Specialization Board, and also the production of other allied health personnel from other academic institutes. These large number are well trained, have the commitment to work in the country, and also they are contributing in the neighboring countries and strengthening the systems in other countries like Gulf region, for example. This is one of the strengths of the country, and all of these health workforce now either are outside the country, they are interested to come back to contribute to rebuilding of Sudan, or they are within the country now, they are providing the services, scaling up of the services in different states. Even now, we have seen number of specialized services, not even before the war, in north part of the country, central part of the country, in south part of the country. They are providing specialized care services, specialized interventions like cardiac surgeries, cardiac interventions, orthopedics, advanced orthopedics and CNS interventions, issues like that. And this is one of the strengths of the health force of Sudan. And at the end, I think the power of the hope. We hope that Sudan will be rebuilding again. Sudan will become better again. And that hope, I think, is a strong driver for the Sudanese population and for the Sudanese health workforce to come again and to build the country. And we have a slogan for our services in the country now. We are always say, despite what is happening in Sudan, we must continue. رغم الحاصل لازم نواصل. Thank you very much, Dr. Haitham, and sorry if I took more than the time. Thank you very much, and over to you.
Thank you, Your Excellency, and I think this is very transparent communication, and we have been waiting long for such an informative and explanation of what is happening on the ground. And although we have some access to the media, but it is always good to have those kind of information from the authority. And I think your presentation provided some clarifications, answers, but also raised many other questions, and we will continue with you. But I would like to take this opportunity and ask Professor Salman. For those who don't know Professor Salman, and I doubt any doesn't know, but Professor Salman is one of the public health leaders globally, and he has impacts on our health system here in the region. Professor Salman is leading the Public Health at Imperial College in London, the director of WHO Collaborating Center there. He is the president of the Arab Public Health Association, and of course, he has impact in improving and advancing public health system in many of our countries here in the region and UK plus. But I will keep mentioning those achievements, and but I want to make use of his precious time. I know that he's now talking in a conference in Paris, but Professor Salman, if we take it from the last point mentioned by His Excellency, can Sudan afford a second year of war? I'm referring to the health sector in Sudan. And from your experience and referring to similar conflicts that happened in our region, Iraq, Yemen, and many other countries, how do you see the current as well as the short and long-term implication of this war? And please feel free, and you have up to 10-15 minutes for your contribution. Back to Professor Salman.
Professor Haytham, thank you very much. And I'm really grateful for His Excellency. Did help us a lot. I always thought we are familiar with what's going on there, but there are a lot of good initiatives happening there. To answer your question, I mean, first and foremost, this is not a war. This is a self-inflicted injury. This is within. The definition of war is attack by another country or war between two countries, dispute on something. But this is the army and the militia, which they work together to serve the population. They are now letting down the population to such catastrophic level. And indeed, it is a wound within. Let me repeat this, a wound within, i.e., that needs to be stopped. One of the ingredients for the change and the positive point and the hopeful message from His Excellency are all fantastic. But this, honestly, from our experience, cannot continue or reach the level to cover the entire population unless there is end to the war. From Iraq experience, Iraq, the war didn't, the conflict, the American occupation and American imposed war, illegally, if I may say, until today, this 20 years later now, Iraq did not recover fully. And you need to remember, Iraq is a very rich country. Sudan, too, is a rich country. But at least Iraq can export oil. They have a lot of internal resources which could be used effectively. So the reason Iraq couldn't recover, because population movement, good number of top-level doctors, nurses, and other health professionals left the country after the war. A very large number of people were affected by the conflict. As you know, immediately after the invasion, the Americans systematically killed academic leadership, etc. More than 3,000 of those people were almost assassinated by various means. Some of the neighboring Arab countries took part into that. Some neighboring Arab countries protected some of the health professionals and academia. So the recovery is not, after conflict of that kind, is not easy. It will take time. I admire the minister approach and indeed what he referred to the Sudanese people within the extended families and the way they are look after their people and their country. I know Sudan very well. I've been there. We were very proud in the way the health systems was developing, especially in primary care. Despite limited resources, which is already mentioned, actually Sudan did extremely well in the primary care and started to extend it. They have some fantastic program within the Arab Board and Al Jazeera training program for primary care. I also visited Sudan to assess the issue of public health some time ago, and the Institute of Public Health and the work which they done in various universities in Khartoum, Dammam, Jazeera are really outstanding. And my point about that is that Sudanese, and especially doctors, which we know, they are among the best in the Arab world, and we are proud of them. Even now, I'm in France, actually, in Paris. Met some colleagues from Sudan. They are here early this morning, and we were discussing the situation and their heart and their mind in the country. So the war must be stopped. The efforts, if I may say, I'm just referring to a few points. I mean, now it's for the Minister of Health, and His Excellency already mentioned that, is 5 points. But to me, this is an emergency situation. The key things, maintaining essential services may be possible in certain areas, but certainly is that emergency preparedness and responses need to be ready there. And people need to be trained, even in war situation, even in a crisis situation. We always advocate for people to train in emergency response, especially the rapid response team. WHO, Geneva, I know WHO, EMRO, have a link to that program. We recently a number of people in the Kingdom of Saudi Arabia, and we could really lean on colleagues who already trained in Saudi Arabia to support the Ministry of Health in Sudan, the Federal Ministry of Health in Sudan. We will be more than happy to do so as well. I think I go back to my original point, and let us be very honest and sincere. That war must be stopped. And let me use a word with the permission from His Excellency. This is a stupid war. As I said, this is not a real war. This is a conflict inside the army and the militia, which is set by government, which the rapid response forces, which is meant to protect the population of our beloved country, Sudan. And the result is exactly the opposite. Those people responsible for it should be punished, should be for the crime they committed. And they need to know from now, the government needs to declare these are war crimes and these are criminals. They should face justice, and the army, the national army, should prevail across the whole country. And as far as within Arab Public Health Association, within Imperial College London and our WHO Center, we are more than ready to help. And by the way, we approached over the last 6 months, and thanks to Dr. Mohammed, and I'm really, really grateful to Dr. Mohammed. He's always a dynamo, initiating things in positive way. We approach many donors and ask them to support Sudan. All of them are positive, but they said we cannot move and mobilize resources unless the war is stopped. And I stop here, and I hope by the time I stop, the war will stop. Thank you.
Thank you, Professor Salman, and as always, very bold, and you share your opinions and advices very clearly and bravely, if I say. So, sure, we'll come back to you, Professor Salman, with more questions. But here I would like also to have an overview about the situation, the contribution, and the expected impact, both short and long term, but this time from a different point of view. As we know, now the health cluster in Sudan is coordinating the humanitarian work in leadership jointly with the Ministry of Health. And recently, we are fortunate in Sudan to have Dr. Shib Sahbani as the new WR leading the WHO country office, who just joined the office in March in a very challenging time. But I'm confident that with his experience and enthusiasm, he is able to work close with the Ministry of Health for the good of our people in Sudan and the health system. So Dr. Shibl is a medical doctor, graduated from Hassan al-Thani University in Casablanca. He has a master's degree in development studies and global health, and has more than 25 years of experience in development and humanitarian aid. Dr. Shibl worked for UNFPA as a representative in Central African Republic, acting representative in Libya, and regional reproductive health advisor for Arab states, and humanitarian coordinator in Jordan, Tunisia, and Morocco. And before joining the UN, Dr. Shib worked for private, public, and NGO sectors. Welcome, Dr. Shib, and please share with us your reflections on what is going on in Sudan and how you found it since you arrived to Sudan. Mike is yours, Dr. Shib.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum jami'an. Thank you so much, my dear brother and friend, Dr. Haytham. Thank you so much. I have the privilege to be with His Excellency Dr. Haytham, Minister of Health. It's always a privilege and a pleasure to be with you. We were together yesterday for another meeting, and it's always very inspirational to hear His Excellency talking about the health system, and especially in Sudan. And also, I'm pleased to be in this panel with Professor Salman, with whom we had many joint webinars along with the MENA Health Policy Forum, UNFPA, and other institutions. So first of all, I would like to say that the picture that was drawn by His Excellency is, it's comprehensive. He addressed the different issues. He addressed the different ways how we can see the health system in Sudan before the crisis, during the crisis, and let's say that now at the end of the crisis, hopefully, inshallah. But I would like, I have 4 slides. I don't know if I should use them or not. But just to give you an idea about the figures that will be shared, and maybe I can share the slides later. Can you see them? Please confirm, Dr. Haytham.
Yes. If you can
excellent.
put into presentation mode. Yes.
Let me see. Is it on presentation mode now?
Perfect.
Okay. Thank you very much. So the situation in Sudan, as I said, it was mentioned by His Excellency Dr. Haytham, Minister of Health. Now we are at the 13th month after the onset of the crisis. And let's remember that this is the biggest displacement in the world today. 1 of each 6 Sudanese is displaced, either internally or as a refugee, as an asylum seeker, crossing the borders. And this is a situation which is very, very difficult for all of us. Now, even before the crisis, we have to accept that the health system was very resilient, but it had some challenges. Some challenges related maybe to human resources, related maybe to funding, but the reality is that there were some issues, and they will come back to that. Now, just to give you a few figures, according to Ministry of Health, there is over 27,000 injuries. And according to ACLED, we are talking about 6,000 fatalities, which is a very big toll. In addition to that, the system, the health system in Sudan is facing many crises, not only one crisis. There is the huge needs in terms of trauma care, which is directly related to war. But in addition to that, His Excellency mentioned the outbreaks. You know that we have 4 ongoing outbreaks at the same time, and 12 out of the 18 states, they have at least 2 ongoing outbreaks. Here I'm talking about measles, malaria, dengue fever, cholera, and also suspectuosis. Sometimes we forget to mention that as well. The figures there, I'm not going to go through all the figures. In addition to that, there is some other issues, malnutrition. And we have here some indicators regarding the phase IPC3, and 37% is either IPC3, 4, or even some of them in 5, IPC5. There is also some other things that we don't mention usually, is that the life continues. There are still NCDs, and here I'm talking about diabetes, about hypertension, about kidney failure. All these people, with war or without war, they still need healthcare services, and they are often forgotten, not by the health system, but by the different stakeholders, including the donors. But just to summarize the situation, now we have pre-war, we have certain challenges. The universal health coverage at 2021 was at 43.5%. there was a considerable shortage in terms of medical supplies. The essential medicines availability was at 30.9%. And then the war hit. What happened is that we have almost 15 million of people who are in urgent health need. And we are targeting, with the estimation that we have, we are targeting almost 5 million people. This is the needs from one side. On the other side, the health system is weakened due to different things that were mentioned by His Excellency. But just to give you an idea, in December, we conducted the HERAMS in 5 states, and it has shown that only 45% of the health facilities are fully functional, meaning that 55% are either non-functional or partially functional. Of course, that was done only in five states. We cannot extrapolate, but it gives us an idea about the situation. In few areas, the situation has improved, as was mentioned by the minister. But in some areas, due to lack of access, due to many other things, the situation has worsened. And we know that many partners, they even left some health facilities due to different challenges. Now, what was the consequences of all this? Deepening nutrition crisis. We have 17.7 million acutely food insecure. And now we are talking about a famine prevention plan that was recently developed by the UN system to scale up the humanitarian assistance, including to address the famine prevention, so we don't go into a famine-like situation. On the other side, as I mentioned before, we have over 1.3 million people who are affected by the 5 outbreaks: cholera, measles, dengue fever, malaria. And I already mentioned that. Now, in terms of response, because that was your main question. I mean, there are different parts of the response: leadership coordination, capacity building, information management, surveillance, the prevention and control of outbreaks, capacity building in terms of risks, and service delivery and delivery of supplies. But let me frame it in 3 main pillars, just to explain the situation. And now I'm out of the presentation. The first one is the response itself. We need to respond to a certain situation. Service delivery, including trauma care, mental health, RMNCAH, different services that we already mentioned. In addition to that, under surveillance, we have also delivery of supplies. And we have the surveillance as well. E1, the lab, and here I want to mention that one of the achievements was to improve or enhance the capacity of the lab in Red Sea to make it as the national lab, since the one that was the main lab was looted. In addition to that, we have capacity building. Capacity building efforts were done in different things, including trauma care. And as we speak now, there is a mission ongoing in Sudan under the leadership of Ministry of Health and with the support of WHO to improve the trauma care capacities. There was also delivery of supplies, and we are talking about 1,200 metric tons of medical supplies that were provided. And just recently, in terms of infection prevention and control, His Excellency accepted a donation of incinerators to manage the waste, the medical waste, and to prevent some infection or medical waste related infection. So just to say that the first part is the response, and in the response we have so many stakeholders who are involved in that. The second part is, and for me is one of the main challenges in any humanitarian response, is coordination. Coordination is a big issue. Unfortunately, we had a very good leadership and coordination by Ministry of Health with support of WHO, but His Excellency is really playing a role of leader in terms of bringing everyone together. But it's not an easy task. Just to tell you that we have 34 stakeholders, only those who are attending the health cluster coordination, but we are sure that there are also others on the ground. And coordinating 34 stakeholders, some of them, they are present in all states, some of them in parts of the countries. They are supporting over 500 facilities, including in hard-to-reach areas, which is really good. It helps the first pillar, which is the response, but it constitutes a challenge for coordination. And I would say that it's well managed until now, and it will be improved very soon, inshallah. The third pillar, we talked about the response, the coordination. The third pillar, which is also very important that we don't talk about it, is advocacy, resource mobilization, and put Sudan on the global agenda. Because the problem is that Sudan, unfortunately, Sudan crisis hit when all the international community was focusing on Ukraine and then Gaza. And somehow Sudan was forgotten. It wasn't forgotten as a crisis, but it was forgotten in terms of support, financial support, advocacy in the media, and so on and so forth. So this pillar, in terms of health advocacy, is still a component which is really important. Now, what were the challenges in terms of the response? The first one, of course, is access. Access and access again is still a big challenge, mainly in some of the Western states, where access is very difficult for all humanitarian workers. And we are struggling with the support of Dr. Haytham. We are trying to find a way how we can improve the access to the hard-to-reach areas, utilizing the different modalities that we can have with our partners as well. The second one is protection. We should not forget this. You know, WHO recorded 62 verified attacks on health care, including ambulance, medical teams, health workers in general, or facilities. Those are only those which were recorded and verified, but I'm sure that this is just the emergent part of the iceberg, but those which were not reported may be much more of that. The third challenge is funding. The needs are huge. His Excellency mentioned let's say the regular budget of Ministry of Health, which is around 1.4 billion even before the crisis. Now, I think this funding is not even reaching 25 to 30% of this envelope. There were some commitments at the global level. We are talking about 2 billion, but actually, what we see on the ground is that the health sector is funded till 11 to 12%. And we are in end of May, which is half of the year, and the health sector is funded only less than 12%, 11 point something. And the next challenge is the capacity, the local capacity in Sudan. You know, Sudan is known to have the best doctors, or one of the best doctors, one of the best midwives, and one of the best nurses in the Arab world. But the problem is that we should not forget that those who are providing the services are also part of the population that was affected by the crisis. They have their own families. They have their own concerns as well. Some of them, they left. Some of them are working in a very tough conditions, in very insecure environment sometimes. Some of them, they are not paid. They are just relying on some incentives and so on. So this is another challenge. In addition to capacity building, the capacity was maybe enough to deal with the normal situation, but here it's not a normal situation, and we need more hands, we need more skilled expertise. So I will stop here because we will be addressing the health system strengthening and how we can move from emergency to the development and peace building in the next phase. Thank you so much.
Thank you so much, Dr. Shibl. And I think what you have shared completed the picture drawn by His Excellency Dr. Haytham. And I was pleased meeting you last week in Sudan, and I witnessed how hard and the challenging work environment actually both our colleagues at the Ministry of Health, WHO and UNICEF now they are working in. And just want to take one of the points that you have mentioned. You mentioned about the advocacy and how to present the case of Sudan. I remember Dr. Muhannad in one of his articles, he called it Sudan, the forgotten crisis and silent death. So my question for our three speakers actually is how to mobilize resources, including human resources, more funds, and how to better advocate for the case of Sudan. And I will start with His Excellency Dr. Haytham, specifically about how to bring together the Sudanese diaspora. We have our colleagues on the ground, but also I know that many of our Sudanese friends and colleagues, experts, are abroad, and they would like to contribute to the ongoing efforts to relieve the suffer of our people there. So how can we bring together those efforts, those good intentions and willingness, and to mainstream those efforts with what the Ministry of Health, what WHO and MFNET and other partners do? So question is for you, Dr. Haytham.
شكرا جزيلا. Thank you very much, Haytham, and thank you very much, Dr. Shibl and Professor Salman Rawaf for the deep elaboration and discussion of the situation in Sudan. To respond to this question, Dr. Haytham, let me start by what has been raised by Dr. Salman. The global, they need to understand the nature of the war. Even the Sudanese population outside Sudan and also the other actors in the world, they need to understand the nature of this war. It is not a traditional war between this militia and two groups and stuff. It is actually a war that is targeting the capacities of the country by the militia. It is a war that targeting the services of the people, whether it's schools, health services, water, and you have seen this in different states that the militia now is hitting. And also it is the war that attacking the civilians and committing crimes. Understanding this situation, it is the first step. The next step, as said by Dr. Shibl, after understanding this, we need together to put Sudan on the top of the global agenda. That means now currently, regardless of how this war initiated, how it started, who began the war, who is responsible for this, let us ask ourselves that there are more than 42 million people now, 9 million children. More than 50% of the Sudanese population are young population. There are need for essential services in all parts of the country. We need to put this picture on the top agenda of the discussions and the indicators mentioned by Shibla as well. The largest IDP worldwide, more than 1 million IDP per month for the first 10 months. Every month we have 1 million of IDP population. and movement on movement. The first movement from Khartoum, the second movement from Jazeera. This is a complex and complicated crisis, of course. We need to actually to take this picture for the sake of Sudanese population, Sudanese children, to put on the top of the agenda and to call for that. And the role of diaspora of Sudanese people, and in particularly the health personnel. Now we have a large number in US, in Europe, in Gulf area, in all parts of the country. Actually, I do thank them very well, very much, that they are contributing with us now. They are contributing with us either directly through a number of health projects they are contributing with, or also most of them now are advocating for supporting Sudan through other UN agencies and global donors. My request is to strengthen the advocacy campaign and the discussion with the global actors to reflect the situation in Sudan. As you have said, Dr. Haitham, in one of the meetings during your last visit to Sudan, that many of the people worldwide asking about Sudan, some are not understand the situation in Sudan. They would like to know what is going in Sudan. And as Shibli said, there is a masking of the picture in the global area, and the situation in Sudan is not clear for most of them. This is one group, and the second group, one understand a little bit, have some sort of understanding of Sudan, but they would like to support. And how to support, they need some of guidance on how to support. And also this one of the role could be exerted by our partners in UN agencies, in diaspora, in Infinite, in other words. This from my side, and over to you, Dr. Haitham.
Thank you so much, Dr. Haitham, and I may have this opportunity to share with our audience and guests that we at MFNET, and in collaboration with the Ministry of Health and the Sudanese Embassy here in Jordan, we are thinking of having a forum or a conference to bring in all those who are interested in supporting Sudan and to advocate for the case of Sudan, and highlight and bring it back to the top of the international agenda. And I think in the coming few days, more details will be out for those who are interested to participate. So I will go next for Dr. Shib before coming back to Professor Salman. So Dr. Shib, we have many concerns are raised there, especially when we hear news about the destruction and looting of the public health lab with all those dangerous pathogens, and we really don't understand the exact. So in such situation, in such conflict and chaos, would this be a threat to the region, if not to the international health security, the situation there? And if yes, how we can send this message to the international community, at least if they are not sympathizing with Sudan, at least they would protect their countries and population. So would you please elaborate on this point? Thank you.
Thank you very much. Actually, it's not a gift, Dr. Haitham. It's a tricky question. Okay, so no, but you are right. I mentioned attacks on healthcare. It has different aspects, and the attack on health facilities and the including the labs is a big issue. Now, what you are mentioning, I can address it in different ways. The first one is to respect the international humanitarian law, the IHL. And here we have to be very vocal and to reach out also to the international community with this regard, because this is very dangerous for the health system and they're very dangerous for the health of the population. Because if we lose the facilities and we lose the health personnel, there is no health system. Those are the backbone of any health system. The second thing is regarding the spread of or the outbreak of the diseases, communicable diseases, as you say. Yeah, this is one part. I'm not expert in that, but I know that Dr. Haytham and myself will be attending next week the World Health Assembly in Geneva, and one of the regional resolutions will be related to that. For instance, on the smallpox and how we can eliminate all the remaining samples or germs. But now I want to mention something else, because you said that the international community, if they are not interested in Sudan, so at least they may worry about the health of their population. I'm sorry to say this, but we know that this exists as well. And the main example is HIV and all the money that is injected for HIV, comparing, for instance, to malaria, just to give an example. But here I want to highlight the fact that we need to have a certain collaboration between the countries. In terms of international health regulation, in terms of movement of population and migrants' health, in terms of how we can analyze the samples. And I know that Sudan now has certain collaboration mainly with Egypt and most probably with Chad whenever it's possible. These kind of things can help also to improve the health outcomes when it comes to communicable diseases. In terms of collaboration between the countries, I would like to say, I think I saw a message coming from Dr. Badr Sheikh, who may be with us now. But just to mention that a few years back, we were working with Dr. Badr Sheikh on a regional initiative with the League of Arab States. And they think this is something which is really interesting, is how the collaboration between the different states can improve the response to any humanitarian crisis, be it a disease outbreak, be it a natural disaster, war, man-made conflict, or whatever. And I think it was supposed to address the points that you raised, how we can make use of the diaspora of any country in the benefit of the country itself, but also in the benefit of the other countries. This initiative, actually, when I left the regional office, I don't know when it has where it is now, but this is something that should be rediscussed among the different states. And they think the case of Sudan can be a very good case, because I met personally with many Sudanese experts, and here we have many of them in front of us, including Dr. Haytham, by the way, so who are willing to help the health system in the country. Some of them, they have their own way to do it, but many of them, they don't know how to help. There is the will, there is the expertise, but we need to give them like a frame where they can support this their countries. And they think this initiative, the regional initiative under the leadership of League of Arab States and the Arab Ministers of Health Council, can be a good one. Over.
Thank you so much, Dr. Shib. And moving to Professor Salman, after we all listened to His Excellency and Dr. Shib, we have somehow an idea about what is going on there. But while we are handling and managing this acute emergency, do we need to put in mind the shape and model of the health system in Sudan after war? Hopefully very soon this war will stop. But is it the right time to start thinking about the future of health system in Sudan learning from this lesson as well as the previous challenges that faced Sudan, or is it too early? From your experience also in other countries. Please, Professor Salman.
Thank you very much indeed, sir. I don't think it's as early. The point here is the whole idea of reconstruction and rehabilitation plan should start now, irrespective, because as we heard from His Excellency and Dr. Shibel, we know now the magnitude as far as this point is concerned. That magnitude may be less or bigger, and then more, you call it war, or the conflict within the army is continuing. So the reconstruction and rehabilitation plan has its own dimension very clearly identified, and we could actually look within the resources in Sudan what's available to carry such reconstruction and rehabilitation, and what type of external support is needed. I guess within the limited resources available to the ministry, Federal Ministry of Health, at the end of the day, an external support definitely will be needed. I mean, Egypt, the Gulf state is mentioned, the Sudanese workforce outside Sudan was also mentioned. You have many dimensions which you kind of bring it all together. Let me go back to Iraq. I mean, I was with David Nabarro in Iraq immediately after the end of the war, sitting there with colleagues about the reconstruction and rehabilitation. We developed very clear reconstruction and rehabilitation plan for Iraq. And this is before the WR actually was replaced and Naim al-Qasir came to the scene. And she definitely from day one, she was involved in that process. But I think it was very, very essential at that stage to know the extent of the damages to the health focused on lecture. So we focused on other agencies which used to support the health services. You know, you need to know that the looting during the war, which is encouraged by United States and Britain at that time, they did not protect the assets of the country, including the health services. So most of the hospitals were looted. So we are talking about some of the hospitals, the health center were very empty. And until today, we are suffering from that damage which happened to the health system. So we started our starting point. We did a need assessment, health service need assessment. We identified, you know, the functionality of the health system. I recall there was something like 30 or 35%. One can describe it as functional, because in certain area, the population in Iraq protected their health services, and others they didn't. The biggest gap was, honestly, in terms of equipment and supply, number one. The second large gap was in workforce. And until today, there are shortages of workforce in many parts of Iraq, despite an increase in supply. And as you know, to have a fully trained doctors require between 10 to 15 years, including medical school. And especially, but still there is a gap. The third area, establishing a governance at local level and at national level. And the fourth area, which was tough negotiation with the occupying forces, the American Authority, on the budget available to the health at that time was about 36 million population. And the budget the American allowed, which is mainly United Nations money, belonged to Iraq, kept by the UN under the sanction, the well-known infamous sanction against Iraq. And so we agreed with the American Authority, both David and I, and met with the World Bank, on a budget of 1 billion, 1.2 billion. 1 billion as a revenue and 0.2 as a capital. And that capital was so small. What we put about 3 billion, we split it into 50-50 capital and revenue. So the damage happened to the infrastructure. So these 3-4 areas of assessment are the measure which need to be taken by the Federal Ministry of Health with the support of WHO, support of other agencies. All of us could contribute to that process. At least there is some clarity in terms of how to move forward and a measure in terms of how long it will take to reach the point, at least to the pre-war level and beyond. That requires strong leadership. And I have absolutely no doubt. The English always used to say that among all Arab countries, the best leader, you will find them in Sudan. And I remember that vividly. And indeed, we've seen that, among our colleagues. We feel very proud of them. Sudanese colleagues, actually, whether in academia or in a health service or in business, they are leading it quite nicely. So Sudan is not short of leaders. We need to bring those people, the willing people, on board to take that initiatives and support the whole process of reconstruction and rehabilitation of the health system. It's a formidable task. We need to remember that.
Yeah, I agree. Thank you, Professor, and for this visionary statement about the establishing the health system in Sudan to be not as before, but even better. So before going back to Dr. Haytham, I just would like to ask Dr. Shibl on if he has any reflection on the future of health system in Sudan, or any closing statement or remark from your side, Dr. Shibl, please.
Yeah, thank you so much. And I really enjoyed listening to Dr. Haytham and to Professor Salman, and also the remarks. I was going through the chat and the Q&A. I think there are very interesting comments that are very insightful as well. From my side, I want just to reiterate that while we are responding to a big health emergency, the health system should be strengthened. And life continues. There are still many other topics to be addressed even during emergency. Here I'm talking about, I'm coming from maternal health background. So maternal deaths, that 2/3 of the maternal deaths are happening in humanitarian context and fragile context. Don't forget that. The same applies to neonatal. The same applies to under 5 children. So here the idea is that while we are addressing the health emergencies, we need to start now building the health system, or rebuilding or enhancing the health system. Here, there are many things to be taken into account. Don't forget that when the health outcomes are worsening during emergency, the inequalities are even bigger, meaning that the most vulnerable are those who are the most impacted by the crisis. And if we don't invest in the health system, we will not be able to address their needs. I want just to conclude by saying that for us as WHO, we are standing with Ministry of Health to support the health system with the focus on two main pillars that I already mentioned, like the funding, but also the human resources. Those are the backbone of the health system, and we stand with Ministry of Health to support them in that. In addition, of course, to the advocacy, Dr. Haytham, His Excellency, he knows that we are doing great advocacy with the international community, not only to put the health system in Sudan on the front, but also to mobilize additional resources for Sudan. And thank you so much, colleagues. And thank you, Dr. Haytham, for organizing this very excellent webinar.
Thank you, Dr. Shibl. And Dr. Haytham, you started your talk about the challenges, and also you gave us some hope, sharing the ongoing efforts despite the challenging conditions. So after listening to Dr. Shibl and Prof. Salman, and there are many questions and excellent suggestions in the chat that we will definitely respond to and share back with our audience. So I kindly invite you to give us like a closing remark, a statement, a message that you would like to send to our audience, both Sudanese and non-Sudanese. Yes, please.
شكرا جزيلا. Thank you, Dr. Haytham. And I would like to thank Shibla and Professor Salman Rawaf حقيقة for sharing this huge experience that will lead and to enable us to move forward. If I would like to say some of the concluding remarks, first, let me to thank Infinite for this webinar, and also to thank Infinite for offering, organizing a platform or a forum to advocate for the health in Sudan in near future. And I do call for all diaspora and all experts to contribute and to be part of of the forum. Second, thank you, Dr. Salman Rawaf, for your advice. While we are addressing the emergency situation and emergency response, we need in parallel to address the issue of restructuring and rebuilding the system. Thank you for these advices, and actually we have started working on this dimension of early recovery and rehabilitation of the system, and particularly in a decentralized manner. As I have said, Sudan is very big. Until now, there is an area of decentralization could be implemented, and we put the ultimate goal of our rebuilding and reconstruction. Our ultimate aim is to ensure accessibility of essential health services to the people of Sudan where they are. And based on that, we shape the decentralized health system with local health system strengthening, as Shibli said, to be closer to the community. And this will be hand in hand, in parallel with our response activities addressing the current issue. Last remark, I would like to thank you very much, and to thank the health workforce of Sudanese inside the country and outside the country. And we hope that the next year this war will come to its end, and to start together rebuilding, reconstruction the country and as a whole, and the health system in specific. Thank you very much, Dr. Haytham, for this opportunity, and I also thank you very much for the panelists and sharing of experience of them, and all we are ready to contribute and to collaborate with all, and welcome to the recommendations coming on in the chat box looking ahead for a better future of Sudanese people. Thank you very much, Dr. Haitham.
Thank you.
Can I say one sentence to thank His Excellency and thank Infinite, but and Dr. Shibble through WHO, through him, WHO colleagues. Sudan got a treasure no other Arab countries have it. They got treasure in human resources. Anyone leading in Sudan should capitalize on that. And these events are very, very sad events. It happened by the people of Sudan, unfortunately. And it needs to stop. It's a great nation, great people. All the Arabs should look at Sudan as a treasure in human resources and agriculture and industry. And this is how should we think? All of us, all the Arabs. And that's the message which we send to Sudan. All of us part of Sudan. We have to love Sudan, and Sudan needs to be healthy, wealthy, and back to its power and play its role fully in the Arab world.
Agree. Thank you, Professor Salman. Thank you, Dr. Shibl. Thank you, Dr. Haitham. Thank you, your audience, and promise we'll be with you in coming events. And have a nice day, a nice night, and see you soon. Thank you all.
Thank you very much.